Alright, this is going to be an ER assessment in a clinical setting. Should be no complaints, just going in for basically a routine checkup. As I come in, looking at my general impression, I just see a mid 20-year-old female just with no complaints. As I come into the room, I'm checking LOC, looking at if she's alert, if her eyes are tracking me, or they follow me as I come in. Does she know that I'm there? I'll ask her a couple questions. Who's the president?
Trump.
How many quarters make a dollar?
4.
So just basic questions that knows that, okay, I know she knows time and place. As I come in, I'm going to check ABCs, looking at her airway. She's talking to me. It's open and maintainable. Looking at her breathing, checking out her chest, make sure there's no paradoxical movement, equal chest rise and fall, no abnormalities. Come down, checking her skin, making sure that she's pink, warm, and dry. Check bilateral radials, making sure they are present, and then also looking at cat refill, no greater than 2 seconds. So I got my ABCs, and also looking at body temperature. Is it hot, warm, cold? I know she's warm. And then I'm looking at her vital signs, making sure there's getting oral temperature, getting respiratory rate, blood pressure, blood glucose, heart rate, and then once I get my baseline set of vitals, go ahead and start doing my head to toe assessment. So starting from the head, looking at her head, making sure there's no abnormalities, there's no immediate dangers or life threats that I see. Palpating for decap BLS, potential deformities, contusions, abrasions, burns, lacerations, or swelling. Don't see anything like that noted. Looking at her eyes, making sure they are pearl, which are equal reactant to light. They are, and I give them out a 5 right now. I'm also looking at her conjunctiva right here in her eyes, making sure there's no mucus or anything abnormal. Make sure that they are white and no coloring or redness. And then also looking at her extraocular muscles, making sure they can follow me hip here, down, to the side. Okay, they're tracking. Also looking at her nasal cavities, making sure they're open, no blood or mucus running down. Open up her, looking at her mouth, see your tongue out, checking out her mouth, make sure there is no abnormalities there. Then come down to her, going to her neck, making sure trachea is midline, no JVD noted. And then also take for Brutus, which just is basically just make sure there's no abnormal blood flow or turbulent blood flow. And then as I come down to her chest, I'm going to inspect it, make sure there's no scars, pastures, or ports or anything abnormal. Go palpate it for tenderness, any tenderness there? No. Okay, then I want to check for her breath sounds at the 2nd and 3rd, midclavicular bilaterally, and then 5th to 6th, mid-axillary bilaterally. And then I'll come in, check my heart tones, how I do that. Right here is aortic, pulmonic, tricuspid will be here, and then mitral will be right here. Check out heart tones. And then I'll just come down to her abdominal area. I'm just checking for inspecting them, make sure there's no abnormalities that I see, no galling or anything. Palpating it in all 4 quadrants, making sure for any tenderness, rigidity, rebounding, and then also auscultating in each 4 quadrants for bowel sounds. Come down, checking the hips, making sure they're stable, making sure no incontinence or anything noted. And then as I come down the leg, I would inspect both legs, and then palpate all the way down on both legs, making sure there's no edema or anything noted. Then I'll come down and check range of motions of the hips, making sure they're all there, good range of motion, and hips, knees, and then also the ankles. And then also looking for, with range of motion, looking at good flexion and all these joints as well. So abduction, adduction, come down to the knee, flexion, extension, then also with the ankle as well, flexion, extension, and then just overall range of motion. Also here, this time I would also get pedal pulses, which is the dorsalis pedal pulse right here, and then the posterior tibialis pulse right here. And then on both sides bilaterally, of course. Then come up to the arms, palpate, inspect it, palpate for any edema or abnormalities there. Check range of motion in each main areas, making sure in the shoulders, also in the elbow, and then also in the wrist, and then looking for make sure you do adduction or abduction, adduction, flexion, extension, and then with the wrist too, flexion, extension. And I would do that bilaterally, and then make sure just equal grip strength again, and then also good. If you could push against me here, push against, pull back, push against me, pull back. Making sure she's got good range of motion. Come down, check out the spine. Come down, check out her, just palpate for any tenderness or crepiness or step off down through her cervical, thoracic, down through her lumbar region, and then looking for any. Also listen for breath sounds as well. Here. And then back here. And then just looking for good range of motion in the neck. Good flexion, extension, and then with back flexion, extension. Make sure it's good range of motion. There. And then come around back to the front, check out her cranial nerve exam. I already know she's alert oriented times 4 from just talking with her and throughout the exam. Ask you to repeat a phrase. Can you repeat this phrase after me? You can't teach an old dog new tricks.
Can't teach an old dog new tricks.
Okay, and then come through cranial nerve 1, be tested for smell. Have you had any problem smelling or anything in the past?
No.
Cranial nerve 2, you'll be checking each individually. How many fingers? Okay, perfect. Cranial nerve 3, 4, and 6 will be covered with the H pattern test. So follow my finger here, 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 back to here, and then to the center. So mainly just looking, making sure she's tracking with me, she's following my directions. There is no jumping or skipping of her pupils, and that they also constrict when I go in. Cranial nerve 5, looking at, would you close your eyes for me? Gonna be palpating face. Can you feel all that? Can you smile for me? Feeling that, palpating mastoid, the mastoid there, and then cranial nerve 7, be looking at her facial. Can you give me a big smile for me? Smile for me, good. And then also look at, can you give me a surprise look? Nice. Make sure that's all intact. Cranial nerve, going to cranial nerve 8, just looking at good. Cranial nerve 9, good. We're just gonna keep going. Cranial nerve 9, good. Good hearing and balance. Make sure if you had any problems in the past balancing. Cranial nerve 10, can you stick your tongue out for me? Good. Wiggle it side to side for me. Good. You say ah for me? So good. That's for the vagus nerve, and also there I check for cranial nerve 12. Good side to side motion. Now I'm going to check for cranial nerve 11, come down. Can you palpate, push against me here? Here, push up. Good. Just make sure good range of motion through all quadrants there. And that's a full assessment of cranial nerves and a full ER assessment.